Hello. I'll be now saying you the important questions in the region of the head and neck. To start with, let us go with the long answer questions, and the one which I feel important, as said before, I'll be putting a stars in front of that question. To start with, the first essay question is scalp, the layers of the scalp and all those things. For that, a case scenario can be framed like a 40-year-old male who had a fall from a bike has attended a surgical OPD with complaints of swelling around his right eye. On examination by doctor, his right eye vision was normal. There was slight tenderness and swelling around the eye with blackish discoloration of the skin. Now the questions can be the examine or explain the anatomical basis of black eye, describe the layers of the scalp and its blood supply. Likewise, a question can be framed. Other than this, the other questions, essay questions are facial artery and its branches, deep cervical fascia, particularly investing layer of deep cervical fascia can come as an essay. The other three, like the pretracheal fascia, prevertebral fascia and carotid sheath, can be a short questions. Then fourth, triangles of the neck. Recently we have seen many times the posterior triangle has come. Similarly, anterior triangle of neck can also come as an essay question, whereas the suboccipital triangle is a good short answer SAQ. Okay. Coming to the next one, important one is thyroid gland, for which usually most of the times a case scenario can be framed, and it can be framed like this. A 30-year-old woman presents with history of weight loss, increased heartbeat, increased sweating, tremors and an enlargement seen in the midline of the neck, exophthalmos. Now the question can be, what is the most likely the diagnosis? Write about the affected gland in detail. So you have to write about the thyroid gland. Now coming to the next essay question, which is the parotid gland. A case scenario for this also can be framed, and it can be framed like this. A 10-year-old girl was brought to hospital by her parents with complaints of difficulty in chewing. The doctors noticed the side of the face and noted that small reddish swelling in front of the ear on affected side and came to a conclusion of mumps. Now the questions can be, what structure is affected? Describe the affected structure in detail. So for that you need to write about the parotid gland. Coming to the other essay questions, temporomandibular joint can be a good essay. Tongue, very important question. Lateral wall of the nose, nasal septum, paranasal air sinuses. In that, nasal septum can also be asked as an SAQ. Very rarely it is an essay. Then the next important in region of the eye is extraocular muscles. It is very important question at the university level. Similarly, the cavernous sinus. For the cavernous sinus, the question can be framed like this: describe the classification of various dural venous sinuses and describe the cavernous sinus in detail. Something like this question can be framed. A rare question, but nowadays is asked, is palatine tonsil. If not essays, it can be a short notes. Then larynx, an entity of it, like any cartilage of larynx, like epiglottis, thyroid cartilage, cricoid cartilage, arytenoid cartilage, corniculate and cuneiform, can be a short notes. The muscles of the larynx can be a short notes. Any muscle of the larynx can be a short notes, particularly cricothyroid and vocalis. And the cavity of the larynx or the interior of the larynx is a good short question. So overall you need to know about the larynx. Pharynx can be an essay question. An entity of it, like particularly the Waldeyer's ring, can be a short notes or brief question. Then coming to the ear, the middle ear is an essay question. And in the region of the infratemporal fossa, this also can be an essay question. Describe the boundaries, contents and communications of infratemporal fossa, and describing any structure of it, like the otic ganglion, the mandibular nerve or maxillary artery, can be added to that essay question. Now, cranial nerves also are coming. The one which you need to read more or stress more is third cranial nerve, fourth cranial nerve, sixth cranial nerve, ninth cranial nerve and 12th cranial nerve, of which the third cranial nerve is most important. So, these can be essays, of which one is almost sure for you. Coming to the short notes, if you see lacrimal apparatus, external carotid artery and its branches, then we have any triangle of the neck individually can be a short notes, particularly suboccipital triangle. Tympanic membrane forming the lateral boundary of the middle ear can be a short notes. Then auditory tube, ganglions of the head and neck, that otic ganglion, ciliary ganglion, submandibular ganglion, pterygopalatine ganglion can be asked as a short notes or brief notes. Then tympanic plexus of nerves and nerve like cauda tympani, which is a content of the infratemporal fossa, can be a short notes. This is all about the head and neck. Thank you.